This is Dr. Polynice from Revival Wellness, and today we're going to be talking about NAD. Now, what is NAD? Well, NAD stands for Nicotinamide Adenine Dinucleotide. That's a super long name, but remember NAD, it's essentially a derivative of vitamin B3. Now, NAD is an essential molecule in the body. It has to do with energy transport and energy utilization. But once that energy is formed, NAD is sort of the transport system that takes that energy elsewhere into the body. So it's an essential component to energy utilization. But as we age and as we're exposed to toxins, illness, all of those things in the environment, our NAD levels go down drastically. I mean, by the time you're 50, your NAD levels are down by half, and by the time you're 80, they're 20% of what they used to be. So replenishing NAD is essential, and when you do that, you're better able to utilize energy, you're better able to recover from strenuous effort, performance is better. But NAD is also essential in anti-aging and longevity because it's been shown that it participates in the process that slows down cellular aging. So here at Revival Wellness, we have a protocol that utilizes a relatively high dose of NAD because we found that that's what it takes really to get the benefits. So if you've never had NAD before, the protocol calls for 5 initial treatments, and you'd want to try to get those as close together as possible. So within 7 to 10 days, we need to get the 5 treatments, and that constitutes the base or the loading dose. After that, most people will go on a maintenance protocol where you'll get an NAD treatment once a month. But I get questions all the time about, so how do I maintain NAD levels in between IV treatments? So of course, there are NAD in pill form. The pill will be going through your gut and your GI tract, so you will be losing some of it, but some is better than nothing. The one we recommend contains one of the precursors of NAD, which is nicotinamide riboside, and it also contains resveratrol, which comes from red grapes. But in addition, there are also great ways to get it sublingual. So we have sublingual dissolvable tablets. Tastes great too, by the way. So you take 1 or 2 of these a day, and they're sublingual, which means that they're getting absorbed through the mucosa under the tongue. And then we have NAD nasal sprays. So you would utilize this in each nostril once or twice a day. Another great way to get mucosal absorption of NAD. And finally, we have our NAD patch. But this patch is iontophoresis, which means that you apply the NAD onto the patch, and then the patch, before you apply it to the skin, actually has a little battery that creates a flow of electrons through the skin, and that facilitates absorption of the medications. There are a lot of ways to maintain your NAD levels throughout the day and throughout the month. So if you'd like to learn more about NAD, or if you want to set up a consult so we can discuss your personal needs, please go through our website or go through our social media platforms, especially Instagram, or you can just give us a call and we'll be happy to talk.